So my name is Kristen Frank Dixon. I'm a family medicine physician and assistant program director with the residency program. So community and population health is a big kind of nebulous thing. It's an entity that pertains to how the healthcare system is part of the community that we practice in. The community part of that is looking at the specific local community where we practice, because different communities have different population demographics and health needs depending on who's living there and what type of community it is. Here in Lewistown, we're a very rural, we're an aging population. There's a lot of farming. We also have a significant Amish population in this area. So we tailor our training and our healthcare services to the needs of that population. When we're thinking about population health, we think about specific populations of patients, like patients who have diabetes, for example, or patients who are geriatric, and looking at trends over time in what's happening in the health of those populations so that we can sort of direct our programming towards those needs on a population-based standpoint. Over the last 30 years, there's been a trend in the United States towards obesity. There's an increase of diabetes diagnosis and hyperlipidemia and cardiovascular disease. So we're noticing those trends at the national level and at our local level. And so we're adjusting best practices and making sure that we're up to date to be able to offer the best practices and best healthcare interventions based on those national trends. So we're specifically training future rural family physicians. So when you're a rural family physician, you tend to be the buck stops here kind of person, right? So you're practicing in a more rural area where there's fewer specialists typically, and so we manage more of the patient's healthcare, and we really rely on community partnerships. We're trying to ingrain that in our training from really the very first rotation that our residents start off with is the community health rotation, where we teach concepts of social determinants of health. The idea of where you live, work, and play really impacts your health, and introducing them to our key partners in the community who also are working towards healthcare. And then they have 3 years to practice those relationships and learn the value of working, in conjunction and collaboration with the other partners in the community. Well, you can't be a successful healthcare provider just practicing solo. We all work in the context of the village that we live in. And so understanding the importance of making those partnerships, I think, is just key for any healthcare provider, any doctor. We introduce our residents to the concepts of community health and the importance of working with community partners and really understanding the patients and communities we're working with and the bigger picture of the burdens of disease in the United States. So we introduce them to these concepts. We give them that medical knowledge, that population knowledge, and then they spend 3 years kind of practicing these concepts and putting this in the care of their patients. And the idea is that they will then understand the value of these skills and the values of these relationships. So when they move off and start their own independent practices wherever they land, they will recreate the same relationships because they've understood the value of it and where they fit into that bigger picture of the American healthcare system.